The treatment involves laying on a bed and having your legs squeezed in time with your heart rhythm. It pumps more blood around the whole body, and it results in improved sense of well-being.
So who can get this treatment?
Anyone can access the treatment, whether a heart patient or an elite athlete. There are a range of clinics available now throughout the UK, and our plan is to make it much more widely accessible through NHS provision as well.
So you can't actually get it on the NHS at the moment?
At the moment, you're unable to get this treatment through the NHS, but we have every expectation that this will become available on the NHS as we continue to raise awareness.
So it really is just a small group of people with heart problems that are getting this treatment at the moment?
At the moment, the number of people getting this treatment is growing because more and more people are out there looking for alternative treatments, alternative therapies, and more people are seeking to improve their health and well-being by investing in their own treatments, much like people going to the gym, for example.
The big question then is, why hasn't the NHS taken this up already? It sounds like a pretty revolutionary treatment, according to what you're saying.
Absolutely, and that's a fantastic question, and I think there are a number of reasons why it hasn't been taken up so far, partly because the cost historically has been quite high. As a result,
can you tell us what that cost is?
The cost has largely been because of the cost of equipment, and what Renew has now done is produced much more cost-effective equipment that makes this much more attractive for the NHS.
Can you give us an example of how much it would cost to get this treatment to be of use to a person with heart problems?
Absolutely. For a patient with heart problems, they'd need 35 one-hour treatment sessions, which would cost in the region of £5,000. Now, when you compare that with other treatments, but also with the amount of money people would spend on, say, upkeep of their car, thinking about this as a treatment for the people's hearts, then obviously I think that is clearly a good investment.
Thank you, Steve Jones.
Thank you.
Hello, is that Mr. Jones? Can you hear us there down at Tower Bridge?
Hello, yeah, loud and clear.
Okay, that's good. Just to let you know, the next voice you'll hear will be Colette Cooney, our presenter. She'll be introducing into the programme. Is that all right?
That's great. Speak soon.
Okay, bear with you.
Now, there's a new therapy that could help patients with heart disease. It would mean less surgery. But as yet, it's not available on the NHS, but can be got through private clinics. It's also being used by athletes to improve their performance. With me now to tell us about it is Steve Jones from Renew. Mr. Jones, can you tell us exactly what this is?
Hi Colette, yeah, thank you. I'd be delighted to tell you. ECP Therapy is a fantastic new innovation. It's proven to help people with heart disease and, as you mentioned, also elite athletes looking to aid recovery. The treatment involves laying on a treatment bed and being squeezed by cuffs around the lower body, which literally squeezes the life back into people with heart disease.
So how available is this at the moment?
At the moment in the UK, there are a growing number of private clinics offering treatment, and our current activity is helping to raise awareness and helping to drive home the message to make this therapy more available through the NHS, who clearly are under an immense strain, and a number of patients that can benefit from this should have this available through NHS provision in the future.
Now, you say it could prevent heart surgery. Can you explain a bit more about this? What would be the difference in the cost to the NHS between heart surgery and this kind of therapy?
This treatment costs in the region of £5,000 for a full course of therapy for a patient suffering with heart failure. And it's really those patients who've exhausted the surgical options and yet still have those symptoms that this could help prevent them continuing to be a drain on the NHS resources and also improve their quality of life, which obviously has a huge benefit.
So how likely is it that this will be accessible to a large number of people who really are facing heart problems?
It's extremely likely when you consider how much strain the NHS is under, but also the huge ageing population we have and the rising number of people with heart disease. It's a matter of time before this type of non-invasive alternative as a first line of treatment starts to take over and become a more preventative culture, as opposed to treating people after they've already established this heart disease.
Mr. Jones, thank you very much.
Thank you.